Welcome back again. This lecture will focus on the principles of research in wound care. And what I'm going to focus on primarily is a paper that has been recently published in Wound Repair and Regeneration, focusing on the power panel. I'm Tom Serena again. You're going to see this slide a lot. And again, I'm the director of the Strong Wound Healing Cooperative Group. I have a number of things to disclose. Welcome to read this slide. You'll see it on every one of my lectures. So what am I going to talk about? The guidelines for clinical research in wound care. Now, a number of guidelines have been published. FDA published their guidelines for trials, IND trials, investigational new drug trials, in 2006. And a number of other organizations have begun to look at this. I think we're really the first group that really took a good hard look at research specifically in the field of wound healing, wound care, and said there are some guidelines, there are some principles. What are those principles, and can we reach a consensus on those principles that will help us to guide the research, so we can do research that is methodologically sound, that decreases the amount of bias. You know, as a wound care community, we have been highly criticized for the trials that we've done so far, for the studies that we've done. There's a lot of bias in them. There's a lot of problems with our clinical trials. Now, a lot of those aren't necessarily our fault, where there's a lot of problems. But I have to tell you, it's very important that we as a wound care community develop guidelines and standards by which we're going to conduct our clinical trial work.